Hey, good morning, everybody. How are you? I know it's super early and I'm not going to be on here long. I just wanted to take a minute after yesterday morning's live and last night's live to just give you guys a little bit of an update as to what's going on with the conversation that I've been having with Ballad Health. So I'll give it just a minute for you guys to get in here. Good morning, everybody. I'll give it just a second for you guys to get in here so that I only have to say it like once. But I do kind of want to let you guys know what's happening at this point. So good morning, Keisha. Good morning. I know it's early. All right. So for those of you guys who tuned in yesterday and listened, I found out that Ballad Health was planning to. Good morning, Keyshawn. Morning, Missy. Good morning. I guess I started too early. I guess I started too quickly. I'll wait just a second. It looks like folks are still coming in. Okay, so here's the thing. I found out yesterday morning that Ballad Health was planning to close the NICU facility in Kingsport, Tennessee, which is the NICU that saved my grandbaby Bella's life. Good morning, bro. What's up, Stephen? Hey, Julian. Good morning, Shelly. Hey, Rhonda. Just got your coffee. I'm going to do this live and then I'm going to go get my workout in. I see some of my NICU nurses in here. Hey, good morning. Good morning, folks. I don't really know that this is going to mean too much of anything, but I am just I promised I would keep you guys abreast. So as you know, on Twitter yesterday, Alan Levine and I went back and forth several times. That's the CEO of Ballad Health. And then he asked me to send him a direct message, which I did. I shared all of that in the live last night, which I'm not going to recap everything this morning. Here's what I want you to know is once I got off of that live, I found out that the marketing, she has a really long title, but the marketing executive for Ballad had decided to also follow me on Twitter. And so had Tony Keck, who is the EVP, System Innovation and Chief Population Health Officer. He had decided to follow me on Twitter as well. And he chose to tweet me first. So in all fairness, let me say this, you spoke to me first. And he spoke to me and said something about, we were talking about this drive, and them not understanding the significance. They keep talking about this 20-minute extra drive, Kingsport and Johnson City. There's only 20 minutes between the two. And I said, that's not what I'm discussing. I'm discussing the folks who maybe live in Rogersville, and instead of driving 30 minutes to a level 1 NICU, they are now going to have to drive double that time. And this is kind of what I was talking about. And I was like, you guys are not taking this region and the demographics into consideration. Now, you know that I tied all of this back to politics, Senator Rusty Crowe, all of that last night's live. Basically, this is what went down. These two hospitals ran themselves into the ground, paying big executives hundreds of thousands of dollars, like the CEO of Wellmont and Mountain Health States Alliance both made in 2015 $1.3 and $1.4 million each. So you guys are collecting $500,000 in bonuses, and these hospitals, you say, are struggling. And so this is why you need to merge. The FTC did not want them to merge. They ended up getting these special COPA agreements with the state of Virginia and the state of Tennessee in order to merge. And then they turned right around after the COPA was granted, and they took legislation to Senator Rusty Crowe that kept them from having to be fully transparent, like the COPA intended for them to do. So now they can hide information from the public. And it's not just information about being competitive. It's not, folks. So anyway, I did this live about all of this last night, and now they want to shut down this NICU. You're going to have to watch the live last night because I'm not going into all of it this morning. But I will tell you this. I woke up this morning, and as of 52 and 55 minutes ago, Tony Keck, who is, I will repeat his title again because it's long as hell, right? EVP, System Innovation and Chief Population Health Officer at Ballad Health. He comments back to me And he says, in the context of bringing pediatric ERs to Kingsport and Bristol to serve 20,000 visits, expanding ped specialty telemed to all rural services, hospitals, and several rural pediatric practices, expanding opioid treatment to reduce NAS, plus investing in prenatal programs, we are. Now, here's the thing. I don't want to talk about all these other things because I think that money could be better spent in different ways. And so I just don't. And then he says to me, and yeah, I really want you all to tell, especially my white friends that are on here, tell me if I'm reading this wrong, okay? Because I'm going to be honest and tell you that all of my blackness was like, oh, fuck no. So then he says, his next tweet to me says, I'd really like to talk in person or by phone to discuss. We reduced African-American infant mortality by 25% and overall by 12% in South Carolina in only 4 years with a focused community effort. We can here too, let me know. Now, here's the thing. Why are you telling me the African-American infant mortality rate? Why not just say to me, hey, we reduced total infant mortality rate in the state of South Carolina by 12%. Why not say that to me? My blackness jumped up and said, why the fuck are you bringing up the African-American thing? As if somehow that means something to me. And it's okay. So I need you all to tell me, am I reading that wrong? Am I offended for no reason? Do I need to check myself? Is it my issue? Is it me? Because here's the thing. So we are talking about infant mortalities when we talk about moving these NICU units and people not having the access to the care. We are talking about that. But at what point is it necessary to bring up race? Because I didn't bring it up. I didn't bring it up. So you saw the color of my skin and thought you needed to tell me about the African-American infant mortality rate. So thank you. I just wanted to make sure it wasn't me. Because as soon as I read it, I was like, what? So listen to me. We have their attention. Your blackness jumped a little too, Nesty. Mine did. So listen, here's what I'm going to say to you. We have Ballad Health's attention, folks. Their COPAs are not written in stone. Their COPAs can be changed, they can be modified, and they can be terminated. If Ballad Health thinks that they are out of the danger zone or out of their probationary period, that is not the case. That is not the case. So I said it last night and I'm going to say it again. File a complaint with the FTC this morning. Call your attorney generals in Virginia and in Tennessee. The attorney general for the state of Tennessee is Herbert Slatery. The attorney general for Virginia is Mark Herring. You can also flood Senator Rusty Crowe's office and ask him why he passed legislation to enable them. It's called SB 2048. Ask them why he carried legislation through on behalf of Ballad Health that allows them to keep the closure of facilities, the repurposing of facilities, the changing in service offerings. All of that does not have to be made public anymore because of the legislation that he passed. So, those are my recommendations. While we have their attention, I say press, and we're going to keep it going. I'm going to, if you're not following me on Twitter, they are talking to me openly on Twitter. So I'm going to respond back and offer, now listen, I'm not driving all the way to Kingsport to have this meeting unless it's a bigger meeting. Like, I will come to Kingsport to meet with Alan and Tony Keck and, Senator Crowe, and I will come to Kingsport to meet with more than one individual if that's what they really want to do. I will leave Atlanta and come to Kingsport for this conversation. But you can best believe I'm not going to come by myself, and we're going to be well equipped when we do. If not, I'm happy to do it over Zoom in my conference room where I can record the meeting. Those are my thoughts on it so far. So I wanted to give you all an update. That's what's happening. We're going to fight. This is about the NICU unit is the piece that is so near and dear to my heart. But while we have this conversation going, it's the overall healthcare of the entire region. So here's the thing: when you say to me you're going to offer telemedicine to these rural areas, what does that do for those people if they don't have the expert staff and the equipment to handle it? I don't care. And this is what I told them yesterday. So you think a hospital FaceTime with it? I don't get it. I think instead of investing money for all of that crap, having a NICU center in Abingdon, which gives Southwest Virginia one that they don't have after Roanoke, would be a way better option. That means if we did that, if we had a NICU in Abingdon, that means that almost everyone in that area would be able to get to a NICU for their baby within 30 to 45 minutes, instead of, for some of these folks, a 90-minute drive. So and I know that I'm not a hospital expert, guys, but I'm just looking at this, that if you're going to spend $140 million over 10 years, if you're going to invest all of these money in pediatric emergency rooms, well, before we do that, can we do some things that just make sense in terms of making this healthcare more accessible for the people who need it? Period. And at the same time, can we not double the driving time of the nurses who are already in Kingsport, working 12-hour shifts? And let's get out of bed with politicians, and let's start doing what's right for the people, and not for our pockets. That's my message. So I appreciate you guys for tuning in. I just wanted to give you an update. I need to get in my I would think, Shelly, I need to get in my meditation and my morning ritual that I do every day. I gotta get in my good zone and talk to God a little bit, and then go get in my workout. So I appreciate you all. Listen to me seriously. The video that I did last night, the video that I did yesterday morning, the picture that when I said, Ballad, this is what you're taking away. People are sharing it, and it is making a difference. If you have not done that yet, share it. Share it. The power of the people and the power of social media is doing good right now. So let's keep that going, okay? To all of my NICU nurses in Halston Valley, every time I talk about you guys, I get a little emotional. I love you all very, very much. I love your hearts. I love your passion. And I love you for saving my baby and all the babies' lives. So my grandbaby. And, take care of you. Be amazing, guys. Be light and be love. Have a great day. I'm out.